The second wave of COVID-19 infections is ravaging large parts of the country. Maharashtra is among the worst affected and the state has nearly 7 lakh active cases. While the crisis has overwhelmed the healthcare system in many places, Maharashtra's Nandurbar district is an exception. Nandurbar district has vacant beds and is even treating patients from neighbouring states like Gujarat and Madhya Pradesh. The district has oxygen plants of its own and surplus oxygen today that is being diverted to places in need. The district has managed to slash its COVID positivity rate as well as daily infections. To discuss the situation in Nandurbar and potential lessons for the rest of the country, joining me now is the District Collector, DR.RAJENDRA. Dr. BHARUD, thanks very much for joining us here on CNBC TV 18. You know, I have to first congratulate Better India for highlighting a wonderful story of Nandurbar, a story that has been brought to the nation's attention courtesy your efforts. But I want to ask you this, Dr. BHARUD. You know, what we've heard from the central government, what we've heard from state government after state government is we didn't anticipate the second wave, and hence we are in the predicament that we're currently in. But you did anticipate it. How is it that you started preparing for the second wave way back in September of 2020?
Well, first of all, I would like to say thank you for these kind words. Nandurbar is a remote district. It's quite around 8-hour journey from Mumbai. It's bordering Madhya Pradesh and Gujarat. I myself, I had an MBBS from Mumbai. So any pandemic, if you see any pandemic situation, it always go with the wave pattern. So when the first wave started, there were a huge number of spike happened first in China, then in the Western countries, American countries, and then later on, in India, the spike gone in July, August, September. After September, when the cases gone down, it's a nature of any pandemic that unless and until there's a permanent solution, there's no permanent solution, this is going to come again and again. So when first time the COVID wave hit us, we have very less infrastructure in terms of beds, in terms of nurses, in terms of oxygen, in terms of doctors, in fact, in terms of ambulances also.
Right.
We started with the 20 beds. We converted our eye hospital into the COVID hospital because 75% people in Nandurbar, they're dependent on government facilities because of their low income. Our district is around 20 lakh population, 2 million, and 75% population is tribal. So we can't close down or we can't convert our government structure into COVID hospital immediately because regular deliveries, cesarean section, regular treatment all happens in the government hospital only. And we had only 2 MD medicine doctor. We didn't have any single medical college. So we started with the 20 beds. Slowly we had made one dedicated hospital of 200 beds with all centralized oxygen pipeline. And we installed one oxygen plant. But when I was seeing the cases rising in the America and Brazil, at that time we installed second oxygen plant. At that time, cases number were less, but we thought that this is going to happen and this will happen. So in the month of February, we installed second oxygen plant, and third oxygen plant we installed in the March in Shahada, when the cases were little bit going high. Then I insisted private hospitals, you also install small plant at least for your hospital. They installed 2 plants, 2 different hospitals installed 2 plants. So currently in Nandurbar, 5 oxygen plants, which drives air, normal air from the atmosphere, removes the moisture, removes the carbon dioxide and nitrogen, and gives the 95 to 97% pure oxygen to the patients. In this way, we are reducing our dependency. Initially, we don't had any liquid plant or refilling plants. So we were depending on Surat and Bhopal. And at that time, many patients were going outside also. Today's scenario is like this, around 12 to 15% patients from neighboring state and neighboring district, they're taking treatment in Nandurbar. Right now, we have around 1,280 hospital beds, oxygen ICU with ventilators. And out of that, around 250 beds are vacant. And we created isolation facility of more than 7,000 beds, starting from the school, hostel, PSC, rural hospital. And except the medical work like swab testing or vaccination or the patient treatment, all other works are distributed to teachers, gram sevaks, talatis, other departments are doing it so that human resource can be optimally utilized. We had contractually recruited around 200 nurses. We trained them how to do all the COVID related work. At the same time, because we don't have any medical college, so we had recruited BUMS, BHMS, BMS people. We trained them how to treat patient for the COVID. And right now, everything is going smoothly. because of our control room, because of our website, everybody can see the availability of bed on the website. Anybody can call for any issue about the payment issue, about the bill issue, about the injection issue, whatever issue they have, they can call 24/7 to our control rooms.
Right.
So situation is quite under control. And last year, the maximum cases in a day was only 190. So through your medium, I would like to say to all the officers where the cases are not affected right now. Last year, we had only 190 maximum cases in a day. This time, in this wave, the cases went till 1200 in a day. For the district like Nandurbar, to handle a 1200 cases in a day is a huge load.
Yes.
So sometime 1100, sometime 1200. The maximum active load patient went till 9000. But we made sure everybody will get the bed. And those patients who required little oxygen, we started using the oxygen concentrator. Those who required more oxygen, we immediately shipped into tertiary hospital. This is how we started to manage with the oxygen, whatever available resources we had.
Well, Dr. Bharud, let me start by saying congratulations to you and your team because, you give us a reason to be hopeful. It is a tragedy that is unfolding across the country at this point in time, but stories like yours give us reason for hope. I want to understand from you, Dr. Bharud, one, of course, was the fact that you anticipated the second wave and you started to plan in 2020 for the second wave itself. So you are much better prepared in comparison to the rest of the country. But how did you go about getting all of this done, ensuring that you had oxygen supply, that you set up actually 3 oxygen plants, that you were able to go from 200 beds to 1200 beds, that you added your manpower? What was it that made you facilitate all of this, that you could get it done, whereas in large parts of the country, we're seeing an inability of the current infrastructure, the current system to be able to get this stuff done?
In our state, we had this policy of district planning funds. We had the disaster funds. We had the CSR funds. And of course, we get some fund from NITI Aayog also. So convergence of all funds, like we had the depth of ambulances. What we had done under CSR, we approached one company, Mazgaon Doc. They had given us 30 ambulances of Force company and 2 Shavvaika, we say. Then under this 14 finance, we asked all the big Gram Panchayat Nagarpalika, you please take jeeps or vehicles on rent. So 30,000 rupees per vehicle in a month, they are paying the rents. So extra ambulances, around 30 to 40 ambulances we have, which are extra, other than regular government ambulances. Apart from that, we are deployed 16 vehicles, again on the rented basis for the vaccination. See, funds are there at the level of Gram Panchayat, at the level of Panchayat Samiti, at the level of districts. It's utmost important how you converge it, how you prioritize it.
Yeah.
So for oxygen plant, we use disaster funds. We use funds from district planning. One plant requires around 85 lakh rupees. So for 3 plants, roughly around 2.5 to 3 CR rupees. Then regarding beds, regarding mattress, regarding doctor's payment, we have funds under NRHM. So I will say fund is not the issue, at least in the state like Maharashtra. It's about only that, you should be prepared. Like preparedness for any disaster is utmost important. Unless and until we are not prepared, then suddenly wave starts, then situation of panic goes out, then people are helpless, they're not getting the beds. So currently, if anybody wants to get even an ambulance also, they can call our control room. Ambulance will reach to their doorstep and they will pick the person. So first and foremost thing is that we should have proper control room and we should have a real-time updation of all the beds and create maximum isolation beds so that not a single patient will stay at home. If you keep everybody at the isolation, everybody under observation, immediately when his or her oxygen drops down, he can get the facility at earliest. When patient gets critical, when his SpO2 drops down below 50% or below 40%, then the chances that his brain or kidney may damage permanently, and it's very difficult to restore that patient into normal life. At the early stage, he consumes very less amount of oxygen. He hardly takes 5 liters or 4 liters. But in the later part, when the SpO2 goes below 30% or 25%, the same amount of oxygen requires 10 times, like 50 liters, 60 liters. So we are wasting our oxygen.
No, those are very important real solutions that you have shared with us. Of course, the need to create isolation facilities so that you separate those who have been infected away from their families so that you control the spread of the infection. But Dr. Bharud, you shared with us some of the things that you were able to do, and you're saying that funds were not necessarily the biggest challenge that you had to face with. The problem really is better coordination and convergence and ensuring that you don't have government departments operating as silos. What would you share as your own experiences, the learnings from what you've been able to do over the past 1 year with other district collectors? You know, this is a problem that we're facing across the country at this point in time. What are the key lessons that you've learned that you would like to share?
When the COVID wave first time hit in the entire India, our district also, we have around 35% vacancies of nurses, medical, paramedical staff. So, because we are not able to recruit them, it's the government's orders, and when government does the recruitment, then only we can get the staff. So what we had done, except medical work, except the swab collection and the treatment work, and later part vaccination, all other work will be done by non-medical department, like agriculture department, like talatis, like gram sevak, and most important, teachers. So registration process, data entry work, tracing them, taking their addresses, calling them, setting up the call center, every work has been done by non-medical department except treatment, testing and vaccination.
Right.
Because of that, every government person is engaged in some or other COVID work. So that is the thing we have to do. Like we had used all the hostels, whatever hostels we had as isolation beds. In some hostels, we converted oxygen hospital also. In some hostel, we dedicated that hostel only for women. Like this is the women isolation kaksh. All staff, security, doctor, nurses, cleaning staff, even the cooking staff will be ladies only. So they feel very much secured.
Okay.
If you give people-friendly things,
Yes.
like I said, we have the website where you can put your mobile number and you can check what is your RT-PCR test result. You don't have to call anybody.
Right.
So whatever people-friendly facilities you create, then people, they respond it in a very better way.
Absolutely.
If you ask people to come to your place, give the swab, then ask them to call you back and ask for the RT-PCR result, it's very cumbersome.
Yes.
So what we do, if somebody comes positive, we go to his home with vehicles and we take the sample of everybody in his family, neighbors, his friends, then then the result comes out immediately and people also feel very comfortable. So people friendly and comfortable facilities if we give, then I think the situation of panic and chaos will not happen.
You know, I think you've hit the nail on the head. Policies need to ensure that people are kept at the center of them, and that really has proved to be the success of why things are different today in Nandurbar. But Dr. Bharud, do you believe that things in Nandurbar are different? A, because you actually have experience as a doctor, you have an MBBS degree, and so you were able to understand the implications of this virus better, and then put a multi-pronged strategy to deal with it. And why the decision for you, for instance, after getting your medical degree, to come to the IAS?
Well, that happened in the 2012. It's a completely different story. I was not able to get sufficient number of books for my PG preparation. I came from this district only. My education happened in Nandurbar. I'm from tribal community, and my father passed away when I was in the womb of my mother. So basically, my mother was a laborer. She was working hard in the farms. And under government scholarship, I completed my medical education. But because I was not able to pay my PG form fee, not able to pay my PG books, amount of books. So at that time, the UPSC form, the amount is I think only 20 rupees. So I had submitted the form. And in the first attempt, I cleared the exam while I was doing my internship. And in 2013, I joined in IS. So the rest is the history. But anyway, the point is that being a medico is very much helpful for tackling this pandemic. Which type of medicines to be given? Like I had given one talk about remdesivir uses long back. Remdesivir is not applied for everybody.
Yes.
It is used very cautiously, judiciously, and instead of that, you can go for dexamethasone, heparin, ivermectin, or other treatment. And I had trained every doctor of my district, all private doctors, government doctors, and suddenly our consumption of remdesivir gone drastically. Similarly, about oxygen therapy, even higher amount of oxygen, if you give to the normal patient or less patient, it can cause damage.
Yeah.
So the oxygen use is very important. So we started using concept oxygen nurse. Every 50 patient will have one nurse, which role is very dedicated role is this, that she should monitor oxygen continuously of each and every patient. In fact, our health minister, Rajesh sir, also taken this initiative and applied for the entire state that anybody whose oxygen is dropping down, this nurse will increase the oxygen. Anybody whose SpO2 is going up, she will decrease the oxygen. Person who is going for bathroom or other works, at that time, unless and until his or her SpO2 is stable, they will not allowed to go out.
Right.
So this is how, oxygen monitoring is most important.
Yes.
And in this pandemic, oxygen therapy is the key. other than the medicines. Oxygen is the key therapy. Early oxygen given to the patient can save the life of the patient.
Yes. Well, Dr. Bharud, more power to you, and we do hope that you inspire a generation of young medicos who may consider the IAS, the civil services, as a possibility. Thank you so much for sharing with us what you've been able to do in Nandurbar, and we do hope that policymakers across the country are listening. This is the real situation on the ground and the real innovations that are taking place on the ground to manage the COVID situation better. Appreciate your time. Thanks very much for speaking with us here on CNBC TV 18.